Hi, I'm Dr. Kurt Wohler for the SIBO Mastery course. The title of this short presentation is called What Causes Small Intestine Bacterial Overgrowth? Small intestine bacterial overgrowth, also abbreviated SIBO or SIBO, is a condition where larger numbers than usual of normal bacteria are actually found in the small intestine. Most of the bacteria in our digestive system exists in the large intestine. And because of the compartmentalization of the gut, the small intestine and the large intestine are separated. And so therefore they actually have their own unique normal bacteria. So there are different segments within the digestive system, right? So we have the stomach is separated from the small intestine is separated from the large intestine. The area near the pancreas, which is sort of up the upper part of the small intestine called the duodenum, can sometimes be affected by small intestinal bacterial overgrowth, and this can actually lead to reflux or that epigastric discomfort that some people feel. The area down towards the end of the small intestine called the ileum is a major seat of immunity. It can be an area where there's a lot of chronic inflammation. That area is bordered or separated from the large intestine by something called the ileocecal valve. And this valve can become problematic where it starts to allow in large intestine bacteria to backflush into the small intestine. So problems in the ileocecal valve that can occur sometimes through abdominal surgery, for example, or injury. Sometimes chronic infections like parasitic infections, viral infections can cause inflammation around the valve, and that causes a leaky ileocecal valve. And again, we get normal large intestine bacteria that start to backflush into the small intestine. And when that occurs, the small intestinal bacterial overgrowth now starts to ferment different types of foods like carbohydrates, creating gases that can cause a lot of the symptoms, the bloating, the gas, the flatulence, the cramping, the pain. But we can also get inflammatory triggers that damage the surface lining of the digestive system too. So these finger-like projections called villi can become damaged. Within those villi are cells that produce immune factors, cells that help us digest our food and absorb our nutrients. Lack of hydrochloric acid, poor enzyme production from the pancreas, bile acid production from the liver can be contributing factors to small intestinal bacterial overgrowth. Chronic infections, okay, parasitic infections, bacterial overgrowth, acute bacterial infections in the digestive system, Helicobacter pylori, which is a bacteria actually in the stomach, can also affect the health of the small intestine and either cause or contribute to SIBO. Poor digestion of nutrients, poor production of digestive enzymes can also be problematic. As I mentioned before, the problems within the ileocecal valve can also lead to intestinal issues too, where we get a backflush of normal bacteria that causes then an overgrowth of normal bacteria in the small intestine. We can even form biofilm. Biofilm is a natural phenomena of bacteria and fungal organisms that can complicate the SIBO picture. And then through all of this dysfunction, we create a problem in something called the migrating motor complexes. Within the stomach, there can exist Helicobacter pylori, which is a bacteria that's known to cause ulcers. It also sets the tone for digestion and is a known trigger for SIBO. Post-infectious irritable bowel syndrome is a common manifestation or cause of SIBO as well. So that could be from virus, bacteria, or parasites. And as I mentioned before, the migrating motor complexes is this electrical activity that occurs within the digestive system. It helps with the peristaltic activity. It can be damaged because of toxins that get produced by different types of infections. And when the migrating motor complex is inhibited or altered, the normal activity of moving debris and bacteria through our digestive system, through our small intestine into our large intestine becomes compromised, and we create the environment for SIBO to occur. There are a lot of different types of treatment interventions for small intestinal bacterial overgrowth. We can't just focus on just decreasing the bacterial load in the small intestine. That's important, but we have to work on digestion. We have to work on large intestine health. We have to work on the migrating motor complex, which is involved in intestinal motility. We have to work at supporting the liver and gallbladder as well, because those are part of the digestive system too. Testing is essential. We can test for hydrogen and methane gas that is commonly produced because of the overgrowth of bacteria in the small intestine. There's a lot of different information that these tests provide. We can test through what's called glucose solution or lactulose solution, and both tests will provide very unique amount of information. All of this material and more is presented in the SIBO Mastery course. I'm Dr. Kurt Wohler. I'm a co-founder of Integrative Medicine Academy. I've been an integrative and functional medicine physician for over 2 decades. I do lab advising for BioHealth Laboratory. I do a tremendous amount of clinical education for Great Plains Lab. And I'm joined in this course by my partner, Dr. Tracy Tricatella, who's a naturopathic doctor, years of experience in working with people with chronic health conditions, chronic digestive problems, autoimmune conditions. She's also a co-founder of Integrative Medicine Academy. And together, we've put together this very comprehensive online course called SIBO Mastery Course. The material is designed for healthcare practitioners, but is open to anybody who's interested in accessing this information with regards to themselves or perhaps a loved one. There are early bird discounts. There's continuing education credits for those who are desiring that. There are course exams, and then there's always extended access to course material when the course is completed. For more information about the SIBO Mastery course, you can go to sibomasterycourse.com, or if you have questions, you can email to sibomasterycourse@gmail.com. Again, this is Dr. Kurt Wohler for the SIBO Mastery course. Thank you.